Hey there. How is everyone doing? I hope that you're all doing well this morning. It is a beautiful day where I am, very sunny, and we are live inside the Radiantly Alive Woman Facebook community, a community for women who are interested in transforming their well-being and particularly interested in scars. What do they do? How are they bothering us, or how are they affecting our well-being? And most importantly, how to actually work with the scar to begin transforming our physical health, our energetic health, as well as our emotional health. Grabbing it all. That's what scar work can really do. Really a full body, full being, full body and mind kind of transformation. So we are on another scar today. We're going live twice a week inside this community talking about one scar in particular. We're always going through 3 different sections related to one scar. Today we're doing hip replacement scars. This is a pretty common scar site, not just for women, for men and women alike. So we're going to talk all about hip replacement scars in the considerations of what to think about related to the physicality of the body itself. Our second area of interest is the emotion and the energy. What's actually going on and what do we need to consider in that area? And then our third part, probably the most exciting part, is the what to do. How can we start working these hip replacement scars so that we can start taking control of our own health, which is really what this whole group and this community is all about. What are the tools that I can apply right now to directly affect change in the way that I feel? A lot of women are not okay, and that's fine. We're struggling in some way. We have chronic pain, we have digestive stuff, infertility, we have bladder and bowel problems, exhaustion, fatigue, and we want to know answers. We want to figure out why these things are going on, and maybe you've been searching. Maybe you've been interested in how to resolve that for yourself, and maybe you've gotten a lot of benefit. Maybe you're totally healthy, which is amazing. Or maybe you've gotten just temporary results or partial results, and therefore looking for the thing that can really help you. And that may be scars. That answer may be scars for you. So let's get into hip replacements. As you get into this live, please let me know that you're here. Just say hi, or at least let me know that you can hear me. Sometimes my AirPods are not the best. Although you'd think that what you paid for them, they would be the best. But for whatever reason, not so much. I'm just pulling up my notes and making sure that I can see my screen, because sometimes I can't see your questions inside my phone. So I'm just getting that ready, as well as getting my notes in place. And let's go into this. Hip replacements. I'm going to talk about, whenever we talk orthopedics, whenever we talk about orthopedic injuries, we've spoken about a few of them. We've talked about bunions last week. Here we are in another kind of orthopedic surgery. We actually want to go backwards quite a bit and just try to understand why this injury, why this surgery happened. Because a hip replacement is never an accident, or like a motor vehicle accident or a bad fall or something. It is always because of the joint breaking down over time that required us to therefore have some sort of intervention. So we want to think about the long-term compensations that were in our body. If you've ever heard me talk about compensations, I'm talking about compensations in a very positive light. A lot of people think that compensations are bad and that they need to be rid of our body, and I disagree. Sorry, there's a very loud beeping noise. I think someone's fire alarm is going off. That's going to hopefully end in a moment. So I want you to think about compensations. There we go. I want you to think about compensations through the lens of, it's your body actually doing the best that it can with the situation, with the circumstances, with the tools that it's got. So in that circumstance, in that kind of view lens, compensations are actually the way that we're allowed and to do whatever it is that we want to do. That's how we're getting by. It may not be the most efficient way. In general, the body, like the physical body, is going to move in the place of least resistance. And that over time can create a kind of a snowball effect of compensation. But the truth of it is that it's allowing us to do whatever it is that we want to do, but at what cost? So we want to figure out how to resolve the compensation before hip replacement surgery occurs. If that didn't happen, which usually it doesn't, and that's totally fine, we therefore still want to find the compensation, and we absolutely want to treat the scar. Because when you get a hip replacement surgery, you obviously fix the area that was causing incredible pain, incredible misalignment, lots of discomfort, all the stuff that was going on. However, your neurology, your actual body, your movement patterns have not changed at all. You're actually like kind of the same person in a way. You've had a lot of mechanical change, like structural change, but the way in which you're choosing to move your body, generally your lifestyle, your job, or whatever it is, all of those components have kind of remained the same, unless you've had a huge overhaul of your life, which is also normal and totally warranted as an idea. But if we just stick with the kind of general theme here, I want you to think that we want to be aware that an orthopedic injury, an orthopedic surgery is usually from wear and tear, from overuse, underuse, one of the main principles that I teach in the Scars Matter course. And then once you have the surgery, you want to make sure that you follow through and still work on that compensation pattern, that movement pattern, because it's still going to be present in your neurology, in your musculoskeletal system, your muscles, bones, ligament, tendon, fascia. All that will still be playing out. It doesn't matter if you got the orthopedic surgery so much. It just fixed the situation, but you still got to go after the problem, like maybe the source. The source could be a variety of different things. It depends on each person and their set of circumstances, their past injury, their timeline, as I like to call it. And that's really important to get into. And it is a necessary requirement, in my opinion. Then on top of that, the scar becomes your priority, like top priority to work, because you want that area to be good to go. You want it to be not causing any more hindrance than it already may be. And you want to make sure that all the tissue there is moving really, really smoothly. So in my Scars Matter course, I talk about the slide and glide. The slide and glide mechanism in our body is really important. Anytime there's scarring, it will be hindered. It will be hindered with movement, but also all the other stuff in the area is hindered as well. The circulatory system, the lymphatic system, all of the stuff in the area. And because the hip is a massive joint, it's the biggest joint that we have in our body, and it is a dense one. It's very deep, which means that we are pretty unlikely to get a hip dislocation unless it's with a lot of force. It's usually with a car accident or a lot of force, like a motor vehicle, horse, snow, water sport kind of thing. It's much more likely to dislocate your shoulder because that joint is very shallow. It's much more shallow. This is like a shoulder. This is a hip. It like totally encloses the head of the femur, the thigh bone. So all of this we need to consider when we're talking about scars in the area. The hip is just like a bountiful area of tissue. There's an incredible amount of layers of tissue. Tissue is going in all different directions, like muscles that are doing all sorts of different things in the area. There's massive muscles. Some of the biggest muscles in our whole body are attaching in and around this kind of hip joint. So we want to be mindful of that. We want to really make sure that we work this hip scar as best we can. It's generally a very large scar as well. Depending on when you had the surgery and how they've chosen to go in, you usually have a scar like kind of down the side of your leg, and then you usually have one like in your glute buttocks area. It's kind of more rare to have it in the front because there's some really important arteries in there. And so usually they're going through the back and doing the whole replacement through like the back area. That means that it's also cutting through many, many layers of tissue. And we also want to be aware of that, making sure we bring back proper function. Like I always say, wherever the scar is, the muscle tissue nearby, the whole kind of musculoskeletal system that's nearby is impeded. It's not working or revving at its 100%. It's at some other percentage. Maybe it's 80, maybe it's 20. We don't really know until we kind of get into it and really start assessing with curiosity what's going on in our body. So with the physical, all of that applies. Think about the compensation. Think about the scarring, where it is, all of the muscle tissue that it's cut through. It's going to be cutting and impeding, whether it cut there or not, but it's going to be impeding stuff like hip flexion, bringing your knee to your chest, or just walking forward has a hip flexion. It's going to be impeding all the stabilizing muscles of your hip, meaning you may not be able to have a level pelvis. Scars actually may be pulling you into a misaligned pelvis, sometimes called an upslip or a torsion or something like that. You may have heard an osteopath or a chiropractor or even a traditional physio or athletic therapist talk like that. And we're talking about the shape that the pelvis is taking on, where it should be more adaptable, more resilient, and balanced from left to right side. So we also want to think about that. It's an area of a lot of hip rotation going internal and hip rotation going external, lateral or medial, aka, depending on the terminology that you want to use. Then we also want to obviously think about the fact that this is a foreign body inside of our body. That is sometimes challenging on the area and on the person, depending on that person. But we want to be mindful of that. Where we had a natural bone, we no longer. We have something synthetic. And again, they change what they've been using as the joint replacement over time. So you may have something completely different. And I know depending on what your life is, if you're like, for example, like I said before, I have worked with a lot of people who do equestrian or a lot of horse riding, a lot of farmers, a lot of cowboys. They have different types of hip replacements to maybe someone who is more sedentary and has a very low active kind of desk job. They get different type of hip replacements. They're different like sizes and different depths. But yeah, we just want to make sure that we're aware and present with the fact that there's something new in our body. We want to be mindful of that. We don't want to discredit that in any way. It needs to be approached in a way that's very considerate to our body, knowing that it probably is going to take some time, sometimes more than others, to get used to the fact that there's a foreign substance, foreign object in our body. One of the biggest joints in our body I touched on, but this is really important to just think about as far as a hip. This hip area, this area in general, the kind of hip, pelvis, and low back is a area that we commonly refer to if you're a therapist, like a clinical therapist like I am. And all of these three segments, like the lumbar spine, which has 5 segments, the big massive pelvis, which houses a lot of really vital organs, and then our 2 hip joints, these all need to like be communicating together. And how these 3 areas kind of work together, it really feeds into how our knees feel, how our ankles feel, how our feet feel, as well as all the way up in the other direction, as well as on the other side. Most people only have a single hip replacement. However, usually when you have one joint replacement, you're X amount of times more likely to have a double replacement. Maybe it's not a hip, maybe this time it's your opposite knee. That is because the compensation was never corrected in the body, and therefore there's still joint breakdown. There's still stuff happening that needs to be corrected that hasn't been considered. So that's why people get more than one replacement at a time, because those compensation patterns are still present. And we never really get taught how to work and walk and fully integrate the replacement after the surgery itself. We get really like minor, simple, kind of check some things off the list as far as exercises that we need to complete, and then we're kind of off on our own. And in my world, the integration needs to be much more full, which includes the scar work so that we can activate and find those muscles again. And we cannot find them to their full capacity when there's scar tissue laid out like Spider-Man's web, buried deep, trying to find anchoring points, like you all know, which is bone, or in this case, probably the replacement itself. But it's going to be finding like other places to latch onto the pelvis, into the femur bone, and so on and so forth. All of that will also greatly impede your fluid systems. I lump the fluid systems together, the circulatory and the lymphatic, because I want you to just have this visualization that there needs to be a nice clear flow of fluid going into the area to bring nourishment, to bring proper neurotransmitters, proteins, oxygen, all this resources. The immune system needs to kind of go into the area. And then also there needs to be just as well an opportunity for all the stuff in the area to leave, to exit, to evacuate the scene. And that again is hindered when there's scar tissue present. So this is what I want you to think about. in relation to the physical, as well as just these two sections of the body, the side body, as well as the back body. These will be the ones that are hindered the most. The sides of the body, literally like the side of the body, is a lateral line that if you've heard my lives, you're going to hear me say it again. If you Google Thomas Myers and you Google Thomas Myers anatomy trains lateral line, you're going to see this really beautiful blue skeleton, anatomy man with this lovely sweeping blue tissue. And it's going to cross like the whole side of the body, which I really love as a visual. This helps us to understand that the scar on the hip is not just a scar on the hip. It also impacts everything down into the foot and ankle, as well as everything up into the head and this neck head area. Very, very valuable information when you're looking at your own symptomology on a day-to-day. So this is something to consider, the side of the body, lateral body. Then the other thing is the back body. The back body is, as you've probably heard me say, is so important to be able to push and propel ourselves forward. Literally to take a step, we'll go for a walk, there needs to be a forward propulsion, there needs to be a momentum that is created. And this is hindered when there's a big scar going kind of deep and into our like deep hip rotators and glute muscles. Those muscles, those glutes, those hamstrings are big because they're what needs to actually push us through space. So they need to be, functioning all cylinders so that we can make use of them. And if that is not happening because of scar tissue, we want to just be aware of that. We want to know about that. Okay, so that's what I want to say as far as the physical. I'm just going to look through my notes here. Yeah, I got all of those points. And then again, just to touch on, this incision here is big. It's no joke. It's very large. It's not a small incision. Like if you think about the other common ball and socket joint we're thinking about, like the shoulder, those are really small kind of incisions. Not that they're any less valuable or any less important, but the hip has large incisions. They're going deep into that deep joint. That's again very deep in. It's a very good ball and socket joint that avoids us from getting a dislocation. So if you have any questions about that, let me know. Then let's go into the energetic and emotional considerations. All of the stuff that I just spoke about with the physical, we're just going to tie that in as we always do with the energetic and emotion. In my world, we can't really pull these apart. They're all connected because when you have a big ball of scar tissue and you have a big knot that's bound and tight in this area, not only does it restrict all the things we just talked about, but it also restricts any type of energy circulation, any type of movement of energy. Even though you may not be aware of it, you may not feel it, we have energetic channels running through our body in very particular areas that have been documented by types of Eastern tradition, like Ayurveda, for example, as well as traditional Chinese medicine. There are these channels everywhere, and they're absolutely where this hip is. So we're going to touch on that here. Let's just go back to the whole idea that we spoke about with the structure that's going to be impeded. The structure, your anatomy is now different from one side to the other. Like quite literally, you have something different in your body now. So what does that mean? There may be a sense of misalignment. I'm not talking about your structure now. I'm talking about energy. I'm talking about the feeling and the mood that you feel inside, the emotion. There may be a feeling of misalignment or feeling off balance, something that feels not so grounded, or maybe that you don't trust your own footstep, which can be translated as maybe I don't trust myself. I don't really know what to do here. This can all be like the inner tone or the inner dialogue or the kind of inner feeling deep down in there with people who have hip replacements and that have the scarring there. And the scarring just in itself in a physical sense is going to pull you off your center because there's so much of it. So we want to really feel into this energetic side. It's kind of a more subtle side that's a little bit challenging to grasp, but because we just had that big long chat about the physical, hopefully you can start to see like, oh yeah, that makes sense. I know I can understand that. I can see that. The other thing that I want to say about replacements, these like orthopedic surgeries, is there's kind of two camps in my experience. There's the camp that gets the joint replacement surgery done, and they do their homework, and they're really gung-ho, and they feel like they have what they need, and they feel really grateful that they're out of that kind of pain, and they're just ready to roll. They do their homework, they get the range of motion, they get the whatever back, and so on and so forth. Then there's the other camp that doesn't, maybe they are grateful and they do feel really happy that they don't have pain, but they don't do their homework. And when you don't do your homework in these like beginning phases, or you're not diligent and you don't take care of the fact that your body is like a healing mechanism right now, if you don't nurture that relationship with your body and you don't do your homework and you don't have the range and you don't get the boxes ticked by the physio or the surgeon, then you lose out on that opportunity because it's hard to get back over time. I worked with many older people in their like 80s, 70s, 80s, and 90s, where they haven't done their homework as diligently as maybe they should. Maybe they didn't know the impact, or whatever the reason, it doesn't really matter, but they lose the range of motion and they can't get that back. So it brings out a particular vibe, like what's going on internally with the person who is doing the homework, doing the stuff, versus the person who maybe isn't. There's a completely different energetic perspective going on. And this is really important to talk about with the energy and the emotion in these three different phases, which I talk about often. What I just described is like the after phase. So the first phase, if we just roll backwards for a second, phase number 1 is everything that happened before the surgery. This is a very long period of time in an orthopedic kind of replacement setting, because there may very well have been decades and decades and decades of stuff that had led to the overuse that over time created the situation where the replacement needed to happen. But I want you to not so much focus on what you could and couldn't do as far as a physical. I want you to think about the energy and the feeling. Did you feel like you were losing out in some way? You stopped being able to do what you wanted to do, losing your identity because of it, feeling badly that you couldn't walk with your family, or so on and so on. What was the feeling before? The during is obviously the surgery itself. Surgeries are scary. Surgeries could be complicated. Things may not go to plan. You get read the list of the stuff that could happen. If stuff doesn't go right, it's always scary. And that's like a normal thing. If you don't go into your surgery and feel freaked out, there may be something a little amiss there, a little bit of dissociation, which is again just another feeling that we want to be aware of. It can also be about relationship dynamics, care in the hospital itself with the medical staff. Whatever you felt in your situation is unique to your experience. You need to bring that out. What was going on energetically? Then there was the other phase, which is the after. After, like I just said, is anything from the surgery itself, like the healing part, onwards to present day, however much time that has been. So again, we want to think about that in regards to feeling, emotion, what's going on the inside. And to help kind of bring this out a little bit more full picture, like talking about feelings, a lot of people they just struggle to talk about feelings. We think that we're in touch with our feelings, but in general, we kind of aren't. There was a study done, I can't remember by which university, I think it was Yale or one of those prestigious universities, and they said that most people can really only label 4 different emotions: angry, happy, sad, joy, I think was the other one. And maybe it was even 3: angry, happy, sad. It was something like astonishing. Like, where's the other emotions? There's a lot more things that we can feel as human beings. So when we have something going on this area, it's impacting specific energetic channels. The hip is kind of a huge area. There could be a lot of different energetic channels that are being impeded and impacted, and for a significant period of time, most likely. But particularly with the scarring, the channels that it would be bothering is the side channel. So in Chinese medicine, also called the gallbladder channel, which emotionally is generally linked up to feelings like irritability, frustration, resentment, anger, those kind of like hot, tense, like those kind of emotions can get all trapped up and bound up in here because that passageway is not as flowing as it ideally could be or should be. And then the other area that I spoke about when we're talking about forward propulsion, the back of the body, that area is oftentimes the channel of the bladder itself, the urinary bladder. So feelings that could be going on there is primarily feelings of like conflict, unsupported, kind of wishy-washy, this like kind of tug-of-war inner dialogue thing that could be going on. So we want to be aware of that and feeling into that specifically, like I said, in the after phase, but there may be flavors of that in the before. So again, just feeling that into yourself, feeling into that for yourself in those 3 phases is a really powerful practice. Okay, now let's get into our third piece, the what to do. This what to do is a really important piece for me to offer to you because it is often an area that we don't get the info for. Lots of the time, especially these days on the internet, you got a whack of information, but no actual applicability. You don't really know where to go with this. And it leaves us with real good brainy, like cool facts, but actually we don't know what to do with it and it just kind of fizzles. So the what to do, I'm going to give you one thing that I suggest everyone do with every single scar, regardless of the size or the age or whatever, you do it every single time. And I'm actually going to give you one general kind of suggestion, and then I'm going to go into a really specific type of scar work that you can do with the hip replacement scar only. Don't take this technique and do it anywhere else on the body. I'm giving it specifically for the hip replacement surgery scar. It is not meant to be done in this order anywhere else on the body. With the way that I've worked for over a decade now, and I have created a system called Scars Reigniting Your Feminine. This system has been laid out in a very specific order so that it is the most comfortable way to work with your scars. And I don't mean comfortable like it's nice and lovely. I mean, so we don't catch ourselves off guard and we're working very systematically in a really clear, organized kind of approach. So this is only to be done with this scar. I'll give that to you last. So here we go. The first thing that I want you to do with all scars, every single scar, particularly this one, is you're going to do a 3-part practice. This 3-part practice is in this phase 1, which is all about relaxing into it. Phase 2, gathering as much physical consideration as you can. And phase 3, gathering as much energetic and emotional consideration. So what does that mean? Relaxing into. This means I want you to find a place where you're comfortable. In your house, ideally, somewhere where you're comfortable and you want to spend some time figuring out what's going on with your scar. Laying down, sofa, wherever, close your eyes, skin to skin contact on the scar, eyes closed. That's kind of your setup for phase 1. Really meaningfully touching the scar. Not just like, yeah, I'm just feeling this thing because Kendra said to do it. No, I mean like really meaningfully start to touch the area and even say to yourself, like, I'm about to feel into something where I've been maybe consciously or unconsciously struggling for a long time. Really acknowledging that you're about to do something deep and maybe intense. And so acknowledging that, closing your eyes, being comfortable, sitting, laying, that's part 1. Part 2, grabbing the physical considerations, everything that you can grab physically about the scar. I'm talking about, and this is particular for this scar, you'll feel a ton of stuff because it's so big. I want you to feel areas of sensation, altered sensation, numbness, like hypersensitivity, feeling everything in between that spectrum, the temperature, hot, cold, everything in between that spectrum. Feelings of area where there's a lot of tension, where there's a lot of binding, knotting, ropiness, areas where the skin is coming out, areas where the skin is pressed and stuck in. All of that, super valuable. You want to really spend time on the scars. Sometimes, very likely, you'll have more than one. Excuse me. Then, so you're gathering all of that. Then you go into your energetic and emotional consideration. For that, what I want you to do, you go through these 3 phases: before, during, and after, just like I explained. Taking time here, it may feel like the weird one or the awkward one or the I don't know how to get really deep to one. Make sure you're giving enough space, quiet time, relaxation to really feel into this. So important. And then the third one, excuse me, got a tickle in my throat. And then The third one, like I said, emotional and energetic. So we just did all three. Sorry. So we're going to do relax into physical considerations, energy and emotion, what's going on, gathering that and feeling into that so you know what you're walking into. And most importantly, you can recognize that there is a transformation potential just hanging out, hiding inside that scar. What a cool gift to just figure out and have that insight, have that revelation, feel into that and be like, whoa, there's some stuff here. I can work with this. If you touch the scar and you start getting really angry, start feeling really emotional in any way, what is that emotion? Dig deep, start feeling it out, quite literally. So the things that I want you to do, particularly with the hip scar, two things. The general piece of information, a guidance I'm going to give you, is because the hip is moving in so many different directions, like I said at the beginning, we want to make sure that when we're rehabbing, even if your scar is decades old, you want to start working into the idea of 3D movement. We have three planes of movement that we work through, and that's it. We just do combinations of them. We have front to back movements, flexion and extension movements through this plane. Then we have side to side movements, lateral movements, or like going left, going right movements. That's the frontal plane. Then we have the transverse plane, which is all rotational. Rotate right, rotate left. And we need to make sure that this hip is doing all of that 3D movement, triplanar movement, so important. So when you're doing gym routines or exercise routines or Pilates stuff or yoga things, you want to make sure in the back of your mind that you're offering all of that range and potential to the hip so it doesn't get really tight and constricted in one area, and then in other areas it has all the room in the world to move and articulate. So that's just a general piece of guidance. I'm sure, a lot of information that you can find. This is how I work with clients in, obviously with much more detail. That's a number one priority that we need to put into our planning, into our movement. Then what can we do with this scar, with an actual scar treatment, manipulation, manual work? Again, don't do this anywhere else. Don't do it on any other scar. And I'm only giving this to you here because for two different reasons. One, because this scar is so large. It's generally spanning many, many inches, and there's usually two or more. So this makes the work a little bit easier. It's not as needing to be precise. We can be a little bit general here, which is good. We can use that to our advantage. We don't have good palpation skills. We're not really used to touching the scar. This is a good thing to start in a very general way with this scar technique. Then the second reason is because this is a very meaty area. There's a lot of tissue here. There's a lot of muscle, like I was explaining. There may be also a lot of just adipose fat tissue, but in general, this is a very thick, wide, robust kind of area in our body. So that means that there's very little opportunity for you to push into something that shouldn't be pushed into, meaning you're not going to damage anything by doing this easy, simple piece of work here. That's why I'm not saying don't go do it on your shoulder or your elbow or your face or your foot or anything else. I'm saying just keep it here and keep it very simple and just follow my guidance as best you can. So what we want to do is we want to take, how can I show you? A cup-like hand, okay? A cup-like hand as best you can. And the reason why we're going to do a cup is you're going to be doing a movement that looks like this. Kind of like, I can do it on my skin actually, on my arm. So you're going to be pulling the tissue up. I'm pulling the tissue up with my whole hand, meaning I'm not like yanking with my fingers and being really pokey and precise. Is not what we want. We want to get the base of our palm in, wrap around, and kind of hook, and pull up. Okay, grabbing, hook, and pull up. You're going through the whole length of the scar, and it depends on where you are, like where you're at. It could feel really comfortable to do this seated, like I am, just grabbing like the side of my hip right now. And it could be more comfortable if you're laying down on your back or on your side. But here you actually have a kind of a nice leverage point, like you're sitting and you kind of lean into it and you can do it like that. You can pull. Maybe one of the scars you can get to well in this area. Maybe you need to change positions to get to the other ones. So that's my suggestion, this kind of cupping-like movement to pull the tissue. So I'm really using the whole hand, being very general, and just getting that's the not just the skin, getting like the tissue, muscle, fascia, all the connective tissue to just start moving, because that's going to start opening up space for the fluids to function properly again, starting to break down some of that scar tissue, and so on and so forth. There's a lot of positive benefits to that. So if you have any questions, I would love to know about it. Otherwise, I will leave it for the replay. Please know that if you're watching this now and you're like, oh shoot, I missed it live, but you have a question, please just send me a question. Just type it in. I'm very happy to respond and give you a very clear answer in that way. And if it's such a big question that it needs its own live, that's okay. I'm very happy to do that as well. So if you know a woman who would benefit from this video, please share it with them, invite them into this group. This is an incredibly nurturing, supportive community of women who have scars or are at least interested in scar work and the importance of scars on our well-being. So thank you for being here, and I will see you soon. Bye.